I took on the role as chairman of Transforming Health and Social Care Wigtownshire Board. It's a significant challenge, but I want to say at the outset, as Emma has already said, that this was not about getting people together and think about it. It's about getting people to think about the future. It's not that health and social care is broke in Wigtownshire, quite the reverse, but it's about thinking about what changes have to be enacted so that, say, in 5-10 years' time, we have safe and sustainable and appropriate health and social care services. We've used a totally different method than what normally happens when change is deemed to be needed for health and social care services. We've used a method called co-production. I don't particularly like the name of it, but to explain what we've done is that we have gone out to the communities. We went to the Wigtown show, we went to Stranraer show. The project manager and myself have been to as many community councils as possible, and we've met as many groups as possible. And we have asked the users of the services, and indeed the professionals who provide the services, what are important. And our first indications were really quite interesting. We went to Wigtown show and we went to Stranraer show, and we asked those people who were at these events what was important to them. And they come up with 3 important issues. It was physical well-being, good mental well-being, and the one that made us think long and hard was education. And we wondered what that was. But actually what we have here today, I believe, addresses that issue, because so many people, when they require to access services, and that includes professionals, sometimes are unaware of what services are available and how you access them. And if one of the benefits of today's event is that both the population of Wigtownshire and indeed the professionals working in the various aspects of health and social care will have a better knowledge and understanding of what's available.
I'm Chris Files, I'm the Technology Enabled Care Project Lead for the Health and Social Care Partnership, and I'm here today to demonstrate and talk to people about NHS Attend Anywhere. NHS Attend Anywhere is a video consultation system that allows people to have a video consultation with a health professional from the comfort of their own home, using their own device, their own internet connection. It works across a whole range of devices and on lower speed broadband connections. It replicates a doctor's waiting area, so it's a virtual waiting area that people sit in until they're collected by the clinician.
My name's David Hurst. I'm a renal patient and I've had a transplant. Attend Anywhere, I think, is absolutely brilliant because I live 54 miles away from Stranraer as a round trip. So to come in and see a consultant, it takes me most of the day. The consultant is coming from Dumfries, so it's a 2-hour trip across to Stranraer and a 2-hour trip back. That's 4 hours. They see about 3 patients an hour, so that's 12 appointments they're losing every day. I can sit in my own lounge, have a 15-minute, 20-minute appointment with my consultant and get everything done that I need to do without all the travel, without the expense of it and without the time. The other thing I can do is I can go to my GP, have my bloods taken several days before so that when I see my consultant on Attend Anywhere, she's got all my blood results and she knows exactly what my problem is.
I'm Judy Logan. I am the psychiatric liaison nurse for the Galloway Community Hospital as well as Newton Stewart Hospital in Wigtownshire. The message today that we bring is that mental health affects everybody. From the age of 18 onwards, the community mental health team provides service, who I link in with, and right upwards we also do older adults. And so the message is that whether it's acute illness, whether it's dementia, there's service and there is support and there is help there. And the message is awareness, really, that people can get help.
My name's Alan and I'm from Telecare at Dumfries and Galloway Council. We're bringing that technology can help you live at home and stay independent and keep you safe. What we're trying to do is to get people before they have their first incident, they fall and lie all night. We get them before that, they fall and they lie for 5 minutes, so their outcomes are far better. We have fall detectors where people with dementia wouldn't know to push a button, whereas a fall detector, if they fall, would go off automatically. So we use quite a lot of those. We also use bed sensors, so if somebody gets up during the night, we can put the lights on in the house, and if they don't return to bed within a set time, it can put a call through and we would get them whatever help was required. Yep. The cost is £3.60 a week, and you can have everything you can see here for £3.60. It doesn't matter whether I give you one thing or 20 things, it's £3.60 a week. And that includes all the monitoring, all the maintenance and all the repairs to the equipment. Very easy to get it. You just phone the council's main number, ask to speak to somebody from the Telecare team, and they will get some information from you, and we will then come out and assess you. Anybody can refer anybody. You don't need to be old or whatever, you can any age at all, and you don't need to live alone at all.
Hi, my name is Karen Harper. I'm the Programme Manager for the Transforming Wigtownshire programme, and I'm just delighted about the day's activities that we have had here. We were very lucky to be invited to participate in this event, which has been sponsored by the Scottish Parliament, and we were able to bring together lots of our partners from across health and social care, third sector and private. I have been going around everybody, the providers, the exhibitors and attendees alike, and it's just been really exciting to hear what people are saying, the positive feedback that we've been getting. One of the key things that really struck me from someone was that she said it had given her hope for the future, hope for the future of care, and also for the people who are here today. All of the exhibitors have been networking like mad and finding out more about each other and really getting a good understanding of what is available to all of us, not just as users of services but as providers of services, and how we can share that knowledge going forward. This was a key ask from the Transforming Wigtownshire engagements over the first year in our co-production events, and I think we've been quite successful today in delivering some of those key asks from people.